All right, so the first question. Thank you for the presentation, Doc. Any questions, guys? How many students get in each year? What is your...
The intake is quite limited. So like the current first years that were taken, they were taken 6. Out of those, there are 2 of them who were reserved for international slots because the department, what is it called, prides itself that it's a training center for the entire sub-Saharan African region. And obviously, you know, internationally, it gives it much more recognition. So you have colleagues who come in from Uganda, Tanzania, Rwanda, Zambia, Mauritius, the Cameroon, Botswana. We've had 2 colleagues who have been from Botswana in the program. Somaliland, we're currently training 1 colleague from that side. So it's very, you know, widespread. So I would say it depends per year. It can be anywhere between 6 to 10, depending on the available slots, because sometimes you have students who are taken in, and then for whatever reason, they lost a loved one, they lost their sponsorship, they still have their slot, but what happens is that they get the chance to join in the following year. So whenever you get an application approved, that application is valid for 2 years. So that is as per the University of Nairobi, you know, rules and regulation. So broadly speaking, it's anywhere between 6 to 10. So it's a very small group, a very small, tight cohort that will be there throughout with them. It will allow me, I think I have to mention something that is not written, but I've seen it. It's quite, you know, helpful to you. Especially the department tends to favor or, you know, be able to give opportunities to females. If you're a female and you're interested in neurosurgery, because we have very few females, especially within the country, who are neurosurgeons. And if you show interest, the department tends to give you much more weight compared to males. So that's a big positive that you have as a female within the department. Currently, within the training program, there are 3 ladies we have. Then we have 2 ladies who have graduated from the current program we have. So in total, we have only about 5 who have been from here, and the 2 colleagues who have come from abroad, one from the United Kingdom and one from South Africa. We're about 7 or so. So it's a very niche community. So those are some of the things that tend to give you. If you're a lady and they see that you've applied for neuro, they'll give you a lot of weight in terms of your application. Thank you.
Thank you, Doc. Someone is asking if you fail exams more than 2 papers, what happens?
Okay, so I want to answer that question in 2 ways. If you fail more than 2 papers within the entry exam, then you have to reapply the following year. That is one way of looking at it. If you fail in the program, even 1 unit, unfortunately, the department doesn't have a lot of wiggle room for that because it sort of builds up on each year. So we have to take 6 months at least. So the department provides 2 exam opportunities every year in February and in September, or I'd say February and August, give and take. So if you do not pass the February exam, and even if you fail a single unit, then you have to be given the next opportunity available to sit for that exam in 6 months' time. So you don't proceed ahead, but you stick within that particular sub area. Do whatever you need to do for 6 months, and the next available opportunity in 6 months, you're able to sit for the exam. I hope I've answered that.
You answered that exhaustively. We have one more and then we are done. We move to the very few admission slots. Do all of you get to go abroad for electives?
No, not everyone goes abroad. Like in my current year, we've had 2 colleagues who went abroad. So going abroad, a lot of it is done in terms of your financial status. The department will support you in terms of writing the letters, etc. They're establishing collaborations, but in terms of supporting yourself, that would be really, really a high, key factor. So we've had colleagues like in my department right now in my year A colleague was going to the US, a colleague was going to the UK, and a colleague was going to Germany. And if you have that extra expendable income, then you're able to facilitate yourself. The opportunities available here are locally. I myself went to Aga Khan and I really enjoyed my time there. Several colleagues have gone to Kijabe. There is an opportunity to go to MTRH. So a lot of it depends on your own individual self. The department really doesn't control you in terms of where you go, so long as it's a respected and respectable, faculty that you have there. They're able to give you the supporting letters and you're able to go. So for me, the restricting sort of factor is not even the department, but it's more of your own financial capabilities to go abroad. If you have the money and the opportunities there, the department is very, very supportive. But if you don't have the financial capabilities, with neurosurgery, it's a very long program. Many of the colleagues have families, young children, so you'll see that they don't really go abroad. If you are able to do it, then the department is able to support you through it. Thank you.
Thank you, Doc, so much for the presentation. I think most of the questions have been answered. We'll move on to plastic surgery presentation right now. Thank you, Doc. I think we can release you to continue with your case, and thank you for taking the time and joining us and passing the wisdom to our younger colleagues.
Thank you very much. Sorry, colleagues, I have to request to be excused. There are a few things I'm still doing within the hospital. So I hope you've gained a lot. If you need to reach out to me directly, I'm always available on WhatsApp. You can just WhatsApp me, then I'll call you back when I see your message. Thank you very much to you, Dr. Abjabar, and all the best to the rest of the program.
Thank you so much, Doc. We're moving on to the plastic surgery, reconstructive anesthetic. And we're honored today to be joined by Dr. Fred Krieger, who is a plastic surgeon at the C-Level 5 hospital. He was a former chief head of the plastics department at the University of Nairobi. Let me share his presentation. Doc, are you able to see the presentation?
Yes, thank you, Dr. Abdi Jabbar, for that kind introduction. And this is a good thing. I think I didn't have this opportunity when I was choosing my residency. I wish I had such an opportunity to listen in to this kind of lectures before I chose my residency. Maybe it would have made some difference. I can't see the presentation, Dr. Abdi.
I'm working on it, Dr. Dogo.
Okay.
Okay.
It had come, but I think we lost it.
How is it now?
Yeah, it's there now.
All right.
Can put it on slide.
Okay.
Yes. So good morning, everyone. Today, I've been asked to talk about the plastic surgery residency. But before I talk about the plastic surgery residency, maybe I want to start with being more honest. As Abdi said, my name is Dr. Kiriga Marwa. I am a plastic and reconstructive surgeon. I'm based in Kisii. I've been a past chief resident 2 years ago, and I passed through the program for 5 years. So the confusion that I want to start with some confusion because when I finished internship and started working as a medical officer, I was completely unsure about which specialty I wanted to pursue. Just to take it a while back, of course, during my medical school, my undergraduate degree, of course, you rotate in various fields, and anytime you rotate in one, you'll feel like that is what you want to become. When you rotate another one, you want to become that. So when I came to internship, I did my internship in the Defense Forces Memorial Hospital in Nairobi. Of course, they had all the specialties and they had all the resources. So you were really exposed. I was really exposed to most of the specialties. The next slide, Abdi. Yes. So the big question here, you can go to the next slide, Abdi.
Dr. Kiriga, are you okay? You able to hear?
No. No, the next slide. Next slide.
Okay.
Yeah, so the big question is what specialty should I choose? So when you finish internship, everyone suddenly asks you, so what are you specializing in? But inside you're thinking, maybe do I do internal medicine? Do I do surgery? Of course, in surgery, we have very many other specialties. Do I want to do obstetrics, radiology, public health? So the truth of the matter is many doctors are unsure of, at this stage, what specialty they want to choose. And I know maybe some of the audience here are in that stage, but that is perfectly normal. So as I told you, next question, next slide. So onto my personal confusion, honestly, surgery fascinated me. Medicine was intellectually challenging. Obstetrics was, of course, dramatic and life-saving. But I still kept asking myself, really, what should I really do? What will really feel like home? Where do I truly belong? So how I discovered plastic surgery, during my internship, the Defense Forces Memorial Hospital didn't have a resident plastic surgeon. They depended on visiting plastic surgeons. At that time, of course, the surgeons were coming from the University of Nairobi. And there was a difficult case of a soldier who had been involved in, at that time, Kenya was in war in Somalia, and most of the soldiers were in Somalia. And we had some attack in Somalia. I don't remember the exact name. And we had one soldier who had really a fracture with extensive soft tissue loss that needed some flap cover. So when the plastic surgeon came to the Defense Force Memorial Hospital, he looked for someone to assist him in the case. And most of my intern colleagues didn't like surgery. And my consultant at that time forwarded my name that I would be the one who will assist him. And when we finished the case, it was something very interesting that I'd never seen. We did a procedure, a free flap, where you transfer some piece of tissue from elsewhere with its blood vessels. In this case, we took the tissue from the upper back. We took the latissimus dorsi muscle with the artery and the vein, then went and looked for recipient vessels in the leg and covered that soft tissue defect. Of course, the surgery was a long surgery, but at the end of it, this is something that I had not experienced all through my internship. Of course, this was coming towards the end of my internship. Then I was invited to one of the conferences. Of course, every specialty will have a society, and the society will always have their annual conference. So the conference was in AMREF Training School in Nairobi, and I asked, of course, the medical superintendent for the permission to go and attend that conference. So when I attended the conference, of course, it was attended by plastic and reconstructive surgeons from all over the world. Of course, all the residents in the University of Nairobi were there from first year to fifth year. They were presenting their dissertations, interesting cases that they've done. Of course, the visiting plastic surgeons from all over the world also presenting some of their cases. So the cases that were being presented are things that I'd never really studied in school. They're things that I had never seen in my internship, and that really opened my eye. There were very interesting things, a lot of creativity in it, and I felt like this is what I needed to do. So you can see just scrubbing in one case, having an opportunity to attend a conference and seeing what the scope of the specialty is, that changed my mind and shaped my journey towards plastic surgery. Next slide, Abdi. So next slide, I think we've talked about that. So what is plastic and reconstructive surgery? So plastic surgery is one of the specialties that is problem solving. It's actually a discipline in a surgery that basically just deals with solving problems. Of course, the program name is Plastic Reconstructive and Aesthetic Surgery. So we have the aesthetic surgery aspect, which mainly deals with cosmetic surgery. And of course, when many people hear about plastic surgery, that is what comes into mind. But there's a lot than just aesthetic surgery. So we have a lot of reconstruction that we have to do. We operate from head to toe. So just in brief, some of the things that we do, of course, we tackle burns, facial trauma, hand surgery is part of plastic and reconstructive surgery, cleft, clip, and palate, just to mention among few congenital anomalies that we do. Of course, you also deal with congenital anomalies of the hand. Patients who have cancer in any part of the body, once the cancer is gotten rid from surgery, of course, there's a big defect that has to be reconstructed. So that's the reconstruction. For example, a patient comes in with a CA of the tongue and the tongue has to be removed. So you have to give this patient a new tongue from the patient's own body tissues. Our patients come with a tumor of the mandible and you have to resect the whole of the mandible. You have to reconstruct a new mandible for these patients from the patient's body tissues. Patients with breast cancer and they have lost one or both of their breasts, and you have to give this patient a new breast. So basically that is what cancer reconstruction mean by that bullet. Of course, you also deal with complex wounds, congenital anomalies I've just said. And then lastly, we have aesthetic surgery, of course, definitely from head to toe. We have facial aesthetic surgery, the trunk, breast surgery, breast augmentation, trunk, of course, tummy tucks, Brazilian butt lifts. On the face, of course, you can do brow lift, Botox, rhinoplasties. So all those are procedures that you learn during the residency program when it comes to aesthetic surgery. Next slide. Just to add on to that, of course, hand surgery and reconstructive surgery, we also do reimplantation. Of course, patients come in with any of their body parts amputated, traumatic amputations. You have a wrist amputation or a penile amputation. We reimplant any of those organs that have been amputated. So the training program in Kenya is mainly done in the University of Nairobi, which is housed at Kenyatta National Hospital. We have affiliate training institutions. We have the residents who go to various other hospitals, including Kijabe, Hospital, we have KU Teaching and Referral Hospital, we have Nakuru PGH, we have Coast PGH, we have Nyeri PGH. So all those are areas that we have, the University of Nairobi has MOUs with, and residents go there for their external rotations. The department also has MOUs with other international centers. For example, we have centers in India where, just as the previous presenter has said, if you are financially well, then you can really go into those centers. So once you finish, of course, you're awarded a Master of Medicine in Plastic, Reconstructive, and Aesthetic Surgery. Next slide, Abdi. So the duration of training is a minimum of 5 years. That is the minimum of 5 years. Of course, we have, if things don't go well, of course, you can take way more than that, 7, 8, 9, 10 years. That has happened before. So the residency program has changed a bit. Of course, when I was in residency, year 1 and year 2, year 1 was just basic sciences, that is surgical anatomy, surgical physiology, and surgical pathology. And then in year 2, you'll learn the principles of surgery, where you rotate in general surgery, orthopedic surgery, ICU, urology, and all that. Then in 3rd year, up to 5th year now, you will move into the plastic surgery program proper, where in year 3, you learn the basics of plastic surgery. Then in year 4, you'll do much of the reconstruction. In year 5, you'll just do cosmetic or aesthetic surgery. But currently, the program has changed a bit. Year 1, you still do the same thing, but do principles of surgery as well. Then in year 2, you straight go into the plastic surgery training, where you start with the basics. So from year 2 to year 5, we'll have all that as explained before. So you'll get exposed to, of course, yes, all the things that I've talked about before. Hand surgery, burn surgery, craniofacial surgery, reconstruction from head to toe of any defect that you have, be it from tumor, cancer, whatever. Then you'll also have aesthetic surgery, as previously highlighted. Next slide, Abdi. So the entry requirements is just as the previous presenter mentioned. On the entry, once you've applied through the UN application portal, then you will be called, of course, for an interview. The interview, you start with an exam. During my time, of course, we will do physical exams, but of course, after COVID, things changed. You will do an online exam, which entails an MCQ, and then after the MCQ, they will rank, of course, from number 1 to 150 or so. Then, of course, they'll pick the top maybe 20 or so. And then those top 20 will undergo a departmental interview. So, of course, after the COVID era, we all went online. So the interview is online. But during my time, the interview was physical. So you'll be asked, of course, questions related to plastic and reconstructive surgery. Of course, you must have shown interest because it's very competitive. So they need to really pick people who have real interest. So if you've attended a conference before, you've done some research on plastic and reconstructive surgery, you've assisted in a few cases in camps that the society has had. So you really stand a higher chance of being taken in. Of course, the other thing that you have to do is, first of all, of course, pass your exam. And you need to be sure the program is 5 years, so you need to be sure how you're going to fund the program. Next slide, Abdi. So examinations, yes, of course, in my time, every year we'll have an exam, but things have changed currently. So the current program reads, you'll have an exam in first year, then you'll have an exam in second year, and then after that, of course, year 3, there is no exam, year 4, there is no exam. But before you move on to year 4, you must have presented your research proposal in year 3 before you move on to year 4. Then in year 5, you'll do your final exam. Of course, that will include written exams, both MCQs, SAQs, essays, and you also do an oral viva, which is the most important exam. Next slide. So challenges is the same thing as the previous presenter presented. Long working hours. Of course, you'll do complex surgical cases. For example, if you're doing maybe a reimplantation, that's surgery that will take even 12 hours in theater. Most of the time, of course, they come at night. So you may start at 7 p.m. and end even the next day at 8 a.m. If you're doing a free flap case or a patient who has a tumor where you have to involve multidisciplinary teams, so you will have the cancer surgeons, of course, coming in, removing the tumor. Of course, we have the neurosurgeons, for example, if something that is in the head and neck, of course, the bone is gone, we have to put in a plate. And then, of course, you have to bring in a flap to cover that. So it's... we have long operating times. If you go to theater and you talk about time, then they actually consider it as, you may not really give the correct time, but we have long operational hours that you have to really endure. Once we do these complex cases, of course, there is the monitoring of the flaps that are done, which means that you have to be coming to hospital every 2 hours to just look at what you've done, because something can go wrong. You can imagine you've anastomosed an artery to artery, vein to vein. So you can have the patency of that anastomosis may fail at any time. So that has to be monitored at any time. Then, of course, yes, there's a steep learning curve of some of the things that we have to do. Next slide. So on the opportunities that we have, of course, once you qualify as a plastic and reconstructive surgeon, of course, the number is very few. I think currently, we have, 37 plastic surgeons in the country. That is minus, of course, the residents who are in training. Most counties definitely, or most regions in the country will, some have no plastic surgeons, or they'll just have one plastic surgeon, of course, serving maybe 4 or 5 countries. Of course, the much concentration is in Nairobi because of aesthetic surgery. But of course, we have a lot of reconstructive work that has to be done in the peripheries, and there's a lot of work that has to be done in those places. So I think each county needs a plastic surgeon. If I was to count the counties that have plastic surgeons, will not even be at a third of the counties that have plastic surgeons. So you can also establish your own private practice, more so with aesthetic surgery. Most of this work is done in private practice, and it's financially rewarding. The only shortfall on it is these can only happen, of course, in big towns. That will happen mostly in Nairobi, of course, Mombasa, because it follows the socioeconomic status of the people who live in a particular area. You can also decide to really have an academic career. So you could also teach. Once you finish your residency, there are fellowship opportunities that you could still sub-specialize in, for example, microsurgery. This is an important skill that you need to have because once you train as a plastic surgeon, not all plastic surgeons are able to do microsurgery. You can also do hand surgery, craniofacial surgery, and aesthetic surgery, etc. I think we are finalizing. Last slide, Abdi. So in conclusion, when you're choosing a residency program, I've majorly focused on plastic surgery, but this is something that you'll do for the rest of your life. So you need to identify the purpose, your purpose in life. Don't just choose a specialty, choose a purpose. Choose a field that will excite you every time you think about doing what that specialty entails. Choose something that challenges you. As a plastic surgeon, plastic surgeon A will do a different thing, B will do a different thing, and C will do a different thing with the same problem that you have. So it's something that can really be challenging and needs you to really think and be creative with it. Then when you're choosing a residency program, choose something that will allow you to impact lives, because the satisfaction you get from that is quite very rewarding. I think that was the last slide. Thank you, Abdi. Back to you.
Thank you, Doc. That was an exhaustive presentation. We are a bit behind on time. Let me see if there are any questions. Okay, let me see. Thank you for your presentation. Assuming you're a self-sponsored resident, where do you get the time to look and to make ends meet and pay fees? It's a loaded question. Doc, you want to take or I take?
It's okay, I can answer. So if you're a self-sponsored student, of course, doing locums will affect the quality of the training that you have, because you see, you have to work then during the day and go for locums during the night, or vice versa. But yes, it's something that has been done before. We've had residents who are self-sponsored because they are not in any county, and their employer, they don't have any employer, or their employer can't release them to go to school. So there's really no time, but you just have to create time. Of course, but it should not really affect really the responsibilities that you have as a resident to do. It can be tough, very tough, but if that is the only option you have, it's still doable.
All right, Doc, I think we'll take one more and then that's it. Are there any scholarship sponsorships offered for this program, UAN, etc.?
So yes, there are scholarships, there are sponsorships offered for this program. One famous sponsorship that is there is the Smile Train. There's an organization that it's a US organization that sponsors cleft lip and palate surgeries. So they offer yearly sponsorship to they give 4 positions. I'm not sure whether it's currently ongoing. They had an MOU with the University of Nairobi to at least train 20 plastic surgeons for the last 5 years. I think the last year may have been this year, but they're planning to renew the program. We have to confirm those details. So they take 2 Kenyans and 2 foreigners. So of course, you'll go for an interview where the panelists are the University of Nairobi faculty, of course, plus the chief resident and the Smile Train top management, and they will give it based on need basis. So far that is the current scholarships that is available. We have other scholarships as well, but they are not as well structured as the Smile Train.
Right, Doc. What can you say is the bread and butter of plastic surgery? Which procedures do you do on a daily basis? Doc, what is
interesting question.
Yeah.
So bread and butter of plastic surgery depends on where you are. If you're in Nairobi, of course, aesthetic surgery. If you're in Mombasa, aesthetic surgery. Of course, yes. The most common procedure, for example, that we do as plastic surgeon in terms of aesthetics is breast surgeries. Of course, breast augmentation, breast reduction. For the trunk, abdominoplasty, liposuction are the most common procedures that we do. Yes, the other procedures, yes, rhinoplasties, Botox, and very rare. They may not really have money per se. And of course, the numbers are also very few. But breasts and tummy tuck, liposuction, Brazilian butt lift, those are the most common surgeries that are done. Of course, in reconstructive surgery, We have things that can't be done by anyone else rather than a plastic surgeon. Of course, we have defects mostly from orthopedic trauma, open fractures, Gastilo 3Bs and above. That's something that you do like on a daily basis. Of course, burns, they call it a poor man's disease, but it's quite prevalent and you'll have to deal with that every day. So those are the most common things in terms of reconstruction and definitely the other side, the aesthetics.
Thank you, Doc. Thank you for those insights. I think we'll close it at that. I'd like to extend a hand of appreciation to Riga and for coming through and being our chief guest today, and for the exemplary work that he's doing at KC and bringing plastic surgery to the region. We wish you the best in your practice, and we thank you for your service to things over there.
Thank you, Dr. Abdi.
So the next presentation is we're starting the presentation on orthopedics. Maura is going to present the presentation on orthopedics. Maura is a chief resident at University of Nairobi, currently chief resident for the program, and he's going to share with us insights from the program for all those who are interested in that. Sorry, Gary, if you can hear me, you can kindly share. Asante-san. Let me stop sharing.
Good morning. I just would like to confirm that my slides are showing and that I'm audible.
Yes, Doc, your slides are showing and you're audible.
Got it. Just give me a bit. Sorry. Just allow me to. You're okay? Okay, let me start. Thank you again for this opportunity to share with the young and budding colleagues. I think it's a good initiative, and I hope what we are able to discuss will help you even ever so slightly. Thank you. So, as mentioned, I'm Maura, PGY5, Chief Resident in Orthopedics at the University of Nairobi. A lot has been discussed with regards to the university by Dr. Kiriga and Dr. Omar, and by and large, we fall in the same department of surgery. So most of the things we're talking about with regards to admission process and exams are pretty similar. So I'll not really repeat a lot, and I'll try and highlight what I think you need to know that's unique about orthopedics. So this is what we're going to cover. Basically, we'll just talk about the path, the field, the history, the structure and the entry requirements, and the life as a resident. So with regards to the path, the way I look at it, especially during your internship period, a thing that I would advise is that you take up every rotation as and tell your mind that that is the department that you would like to join. What this does is that it allows you to indulge yourself fully in a field, and helps you to know exactly what that field entails, and it helps you kind of have a feel and lets you know this is probably what I want to do, or this is definitely what I don't want to do. So by indulging yourself in the field completely, or immersing yourself completely, you're able to know, you're able to learn one, and then you're able to also know what you want later on. So I created this flow chart because it was an easy way for me to decide what I wanted to do. It's funny because in ortho, it's very similar. The structure is very similar. Is the fracture stable? Is it unstable? Is it open? Is it closed? And then you make your decision. So funny enough, that's how I decided to get into ortho. And so after internship, you're faced with the career decision. And you want to know, am I going into clinical practice or non-clinical practice? Because the degree of medicine, you can utilize it in very many ways. And not all of us have to go into clinical practice. There are still very many important roles and rewarding roles outside clinical practice. And so if you feel after you've experienced the medical field that you want to be in non-clinical practice, there's a space for you in research, public health, education, policy, whatever it is. The other thing I'd like to say at this juncture is if your goal is to make money, that's your goal. You know, people are different, people have different goals. I think all goals are valid. It's okay to want to make money. It's okay to want to do whatever you want to do. I think if you're thinking about surgery as a way, if your primary goal is to make money, I think there are easier ways to do it. And so the choice to pick a surgical field, you should be thinking a little bit more than money. Of course, you won't go hungry, but don't think about it with regards to money because you will get frustrated. It's a very lengthy training process. And I think there are easier ways to make money. So if you decide to go into clinical practice, then you decide what do you want with regards to patient interaction. There are people whose nature, they really don't want to be talking to people every day, and that's also okay. And there are people who are very happy being with people, or there are people who are indifferent. And so this is a point where you make that decision. Do I want patient interaction or do I not want it? If you want limited interaction, there's a space for you there. If you find that you thrive with interacting with patients directly, then now you get the choice of surgical versus non-surgical. And as I've interacted with many colleagues throughout the years, I've come to learn that that's a choice that for many people, it's very easy for them to know. Once they go into theater, there are people who love it. That's what they want to do. And there are people who don't want it at all. And so once you've decided where you lie, then you go down the flow chart. So if non-surgical, you can see you have all your options there. So with the surgical specialties, I'm sorry I forgot to include obs and gyn, but you have all these specialties in surgery. And so for me, I tried to look at all, I was very open initially, but there are many factors that led me to choosing orthopedics. One is that which I'll talk about, my personal preferences. I'll put them in another slide. But additionally, where I did my internship and where I worked as an MO, I was exposed to a lot of orthopedics. And one of the factors when I was choosing training subspecialty or specialty was that I wanted to utilize the experience that I've had during that period and not let it go to waste. And I felt that I was aligned in that space. Furthermore, with regards to orthopedics, I enjoyed the structure. Like we said, in orthopedics, the structure is very straightforward when you're dealing with, especially when you're dealing with trauma. Your question is there a fracture or is there no fracture? If the fracture is there, is it stable or is it unstable? Is it open? Is it closed? And all these factors help you make a decision. And the decision is almost a very objective way of doing things. And I like that. That's how my mind prefers to work. Then I also realized early on in life that I didn't like routine. And so what surgery and specifically orthopedics gives me is that every day is a new day. no two fractures are identical, no two deformities are identical, no two trauma patients are identical. So every day I'm thinking or creating or doing something new. Then the other thing is for ortho is I felt I really used to enjoy and still enjoy working with my hands and with tools. And so I felt like that is something that I can employ in my workplace, that, you also having fulfillment at work. And finally, you understand that the patient burden, especially in orthopedics and trauma, is quite high. I think with regards to numbers of surgeries performed in KNH, ortho probably does about, from the last time I saw, about 50% of the surgeries done in KNH are ortho, because you have all these borders and there's a lot going on. And so there's a great need for orthos locally and globally. And so the work is also rewarding, because you're able to see someone from being not able to mobilize properly to being able to mobilize independently. And so that has, high intensity and impact. But as I also went through the path of orthopedics, I came to realize that it is an art. There's a lot of use of your creative spirit, especially in surgery. And I think that applies to other surgeries as well. But the catch is, or the even more interesting part is, that it's reliant on all branches of science. So biological sciences, for sure, it's medicine. Physical and biomechanical sciences, we do a lot of biomechanics in orthopedics. And of course, chemistry. There's a lot of chemical components that we use, drugs, bone cement, all these are chemical reactions. And so you're basically, it's a marriage of science and art. And that's why the surgical field is appealing to me. And a little bit more, I just want to touch on this, not as a comparison, but just to point out that fulfillment in orthopedics ranks quite well amongst all surgical specialties. Of course, it varies for different individuals. There are people who don't like dealing with bones at all, or hard tissues, or that is all valid. But different studies have been done, surveys have been done globally, and orthopedics ranks quite well. It's quite a fulfilling specialty. So the field of orthopedics will deal with trauma. So trauma is a whole separate thing in itself. Actually, when you graduate with your MEd, it's MEd in orthopedics and trauma. So trauma is one field in its own. Then you have spine, arthroplasty, which has to do with joints, pediatrics, sports medicine, which is really big, especially in Kenya, which is a sporting nation. And then you have oncology, and I forgot to put hand or upper limb surgery. This we had talked about. So the history of, now I'm going to talk about the program in University of Nairobi. University of Nairobi is housed, there's an MOU between Kenyatta National Hospital and the University of Nairobi. So our training primarily occurs at the Kenyatta National Referral Hospital, which is a level 6 facility. I think it's the biggest in the region. And so there's a marriage between the university and its staff and Kenyatta and its facilities. And so the orthopedic training program began in UN around 2008. And so you're not just joining a random set of rotations. It's a very mature training facility, and there's regional relevance. So the end requirements are just as have been mentioned before. You have to have graduated, you have a license, you've done your internship, you have your referees, and then you have to be able to market yourself to the university with your records and your ability to interact with patients and also colleagues. And the application is pretty much the same. Application time is through the as was mentioned earlier, and the application process is through the UON portal, and the requirements are all stated there. And so I don't feel like I really need to dwell here. I think if you go to the UNBI portal, you'll be able to see all the things that you require to be able to apply. It's a very competitive specialty. They take between, so it varies. My year, they took 10 out of about 60 plus applicants. The highest I've seen recently, I saw about 15 that were picked. So I think it also varies, but it's somewhere between 10 and 20. So the structure is that it's a 5-year program. First year, just like all the other surgical specialties, you will be in Chiromo for the most part, where you'll do your basic sciences, but you'll also have in tandem clinical rotations in Kenyatta, which is a new thing that was introduced so that you're kind of able to incorporate what you're learning in Chiromo and what you're doing in Kenyatta. So as I mentioned, the base is the Kenyatta National Hospital. Basically, we work 60-hour weeks. That's even stated in our curriculum. And the structure is that you see one, you assist one, and you do one. That's how that's the mantra for the surgical training. We also have, away from year 1, where you have more lectures, from year 2 to year 5, we have lectures every day at 7 a.m., Monday and Tuesday being physical, and then from Wednesday to Friday, it's online. It's student-driven, and so we were given a list of lectures or topics that we should prepare on, and then we present the lecture. We give the lecture to the rest of our colleagues, and then our senior colleagues and our lecturers will discuss at the end of the lecture, giving us important points. And so I think it's a very good way of learning, because as you're presenting, you're also learning how to teach. Part of being a resident also is being able to teach the undergraduates, which I think is also a very impactful thing to do. The program is blessed with experienced faculty. You have UON lecturers backed by KNH consultants who both actively take the role of teaching, operating, and mentoring. So why UON KNH is a good environment? With regards to the training base, it's the largest teaching and referral hospital in the region. So there's a high patient load, wide pathology, and repeated exposure to different levels of complexity. Additionally, there's, the case diversity. There's also a bank of, teachers, because you have the faculty and the KNH consultants who will teach you in the wards, in the clinic, in theater, and in classes. There's also the element where you're thrust into the field, thrown kind of into the, not really the deep end, but in a supervised manner, you're thrown into the pits. And so you're able to grow, you're able to be sharpened, and you don't just become an observer. The service pushes you to becoming better and better. And then regionally, we are able to do, because it's the largest referral facility in the region, you're able to deal with a lot of different cases from the region, interact with a lot of people from different parts of the world, because they identify the facility to come and collaborate. And so there's a lot of regional relevance. And the learning environment, as I mentioned, there's the UON faculty, you have the KNH consultants, and then there's the apprenticeship. There's also your fellow registrars at different levels, and then there's a community, and everyone has the ability to teach you from the even the theater nurses have taught me a lot throughout the years. And so you always have a willing attitude to learn, and you'll be able to gain a lot with regards to skill acquisition. The thing is, you don't need to know everything before you start. That's always a big hindrance for high achievers and anxious people. You always feel like you have to know everything, you have to have read everything before you start. But really, all you need is to be curious, to be resilient, to have a good attitude and be able to be taught, and to have the courage to keep showing up. Even the days that you feel like you don't want to, just show up. You're always 50% better. So a little bit more about the structure. In year one, you're doing the basic sciences that we had mentioned, the anatomy, where you'll have dissection, you'll have classes, and you'll have, the cuts, and then you have physiology, and then pathology. In pathology, there is the clinical chemistry, just like you did in undergraduate, clinical chemistry, hematology, immunology, and all these basic sciences are a good foundation. Additionally, in year one, you'll do another unit called Principles of Surgery, and I think it's self-explanatory. And then finally, you'll do research methods, because as a scientist or in the field of science, you have to be able to impact the field through, and the best way to do it is through research. Furthermore, you'll also need to present a thesis for you to be able to get your MEd. In first year, you will have a rotation schedule, 6 weeks in class, anatomy lab, then 6 weeks in the wards, and in casualty in KNH. So this, you're able to integrate your theoretical knowledge with early surgical exposure. It also increases the amount of time that you're in the hospital and you're able to acquire new skills. Then year 2 to 5, in ortho, we don't have exams every year. We have exams after part 1. And then in year 3, you have to have presented your thesis proposal. This is a new structure. And then by year 4, you've done your thesis, so that year 5, you're just polishing up. But the way the structure is that you have 3-month rotations. So the way the orthopedic thematic unit is structured is that there are smaller thematic units within orthopedics. And so you have trauma, you have spine, you have hand, you have pelvis and arthroplasty, foot and ankle surgery, oncology, ortho-oncology, which is the only one, which is one of the only ones in the subspecialty departments in the region, and the pediatric orthopedics. Then you have external rotations. So external rotations, we go to Aga Khan, we go to Kiwa Kijabe, which is a hospital for deformity correction in children. We go to St. Teresa Kirwa in Meru. We go to Defense Memorial, and then we go to Kikuyu Hospital. And by and large, these are the external rotations that you will be exposed to. You tend to do around 3 to 4 within your training period between 2nd year and 5th year. So every 3 months you rotate, so that by the end of the 5 years, you've been able to experience each of these subspecialties in entirety, and as opposed to previously where it was all the patients were in one ward. So it would mean that at the end of the training period, some trainees would have more experience in one thing than the other. So this kind of balances everything out. And it also improves your the procedures that you've done within the subspecialties. So this is an important slide. I know that cost is something that is the limiting step in terms of getting back to school. This is the fee structure as per 2023-2024. As you can see, year 1, you're paying around 382, year 2, 332, up until year 5 when you pay 362. And so you need about, with regards to tuition, you need about 1.7 million to get your course done. The fees has increased a bit. Some of the guys who finished before us were paying a little bit less, but the fees has gone up a bit, in case you had seen different values earlier on. With regards to your living, most of your work is based out of Kenyatta National Hospital, and so people tend to live in and around that area, so that you're not suffering too much with regards to commute. There's the KNH doctors' flats, which are very affordable comparing to the surrounding areas. Actually, probably one of the most affordable places you can live, but it's a very competitive process to get in. So I would advise you, if you're going into the program, you apply as early as possible, so that by the time you're getting deep into your clinical years, you're up in the queue and you're able to get yourself a spot, so that you're not struggling too much with regards to finances. Then with regards to your thesis, this is also a very big rate limiting step in your program. At least now the structure has made it that you're able to have your proposal done by year 3. Previously, like for my lot, we were still under the old structure, and the process can delay, and it can make you if you have not done your thesis, you're not able to do your final exam. So it's good that you start thinking early if you join the program. And there's also some costs relating to it, but usually it's manageable. So this is the summary. I'm encouraging you to join us and build the future of orthopedics. The 3 pillars: you train, you research, and you also lead by teaching and leading. Because once you're done, you're able to go back into the community and you'll run orthopedic units wherever you come from. And then orthopedics is an art that is intimately reliant on all branches of science. That was a thought that I had, and I felt like it was important to share. My final slide is it's a picture of a bird. And why I put this here is I just, a few years ago, I started getting into bird watching. The reason I'm bringing this point up is, as a resident, you'll find your life is almost taken away and you forget to live. Even as a resident, it's important that your life goes on and that you have other interests, because it keeps you human. And so this is a weaver bird that I found in Laikipia County, and I thought I'd share with you. Just as a point to know is that Kenya is one of the top 5, let's say top 10 destinations in the world for bird watchers, because we have around 11% of birds variety, the variety of species of birds globally. And I think we're actually among top 10 in terms of variety of species. And so you're living in those of you who are Kenyan, you're living in a bird watcher's paradise. And if you're interested, it's also something interesting that I can encourage you to get into. Thank you.
Thank you so much, Doc, for a great presentation. It is eye-opening, to be honest, even for me. It was detailed. I don't think you've left any stone unturned in orthopedics. I think if anyone were to ask a question, they'll ask something extra. For the story of the bird watching and extracurricular activity that anyone has to do, I agree with it fully. Your mental health is important, so you have to balance. Thank you, Doc, for the advice to the young ones, young colleagues who are joining us soon. Is there anyone who has any question for Doc? You can put it in the chat. You can unmute before we move on. Getting a lot of nice feedback on the YouTube stream. People are saying that it was very detailed, and you have left no stone unturned in the YouTube stream. So just some appreciation posts from the YouTube.
Thank you. Thank you.
Any questions, guys, before we release Doc? Everyone on this panel today has a case to go to and they're busy. So if there are no questions, I think we can yeah, I don't see any questions. Doc. This is the thing about being a good teacher. You leave the class with everybody has understood.
Thank you. I appreciate the opportunity. Just Paul Sana will allow me to drop off, but I really applaud this initiative and thank you. Okay.
Doc, there's one question before you leave in the YouTube. Looking at things from a systemic economic perspective, is there an easier
Sorry, you're breaking, Doc.
way to make money?
Hello, sorry, Doc, you're breaking.
Surgery. What does the program attract so many participants?
Sorry, Doc, you are breaking. Sorry.
So someone is saying he thinks that people are attracted. There are other ways of making, you know. Am I audible now?
Yeah, now you're audible, yes.
What about now?
Yeah, now, okay, I can hear you now. Can you hear me?
Yeah, someone was asking, basically what they're asking is, are they able to reach financial sustenance? Yes, I can hear you. If you have not done surgery.
Is my network poor? Hello, am I audible? Sorry, I didn't catch the last part of that question. The doc has dropped off. To the rest, am I still audible? I can try and answer the first part of the question.
Yeah, Doc. I think the question was about is finances a main attractor to join the surgical programs, and is there another way of achieving that without going to surgery? I think that's where people miss the point. The main motivator for
So if your motivation truly is making money, my opinion is that there are definitely very many easier ways to make money if you apply yourself. Even within the field of medicine, I see people getting into supplies. I see people getting into, building facilities. I see people getting into very many different things. There's tech in medicine. I see people doing a lot of software work. Not to say that their work is easy. I'm just saying there are very many things, and even outside medicine, I hear people have chicken farms, and they have become very rich. But that was just a light joke. But people do a lot of things, and they're able to make money. You just need to apply yourself. You need to find a field that you found a niche. And if your goal is to make money purely, I think there are many things you can choose to do. Going through a whole surgical training program in order to make money I don't think is just to make money might not be fair to you. That being said, you can also make money in medicine, I believe. We're also still working towards it. You can say that we are there, but even looking at senior colleagues, I still think you will not be hungry. You will have what you need for yourself. But I just think that I made that point just to say that if your goal, there are people whose idea is that they will come to medicine to make money, and it gets frustrating along the way for many people. That's all that's the whole point. Additionally, when you're undergoing the training, there's a level of commitment that is required. I think surgery, all types of surgery, is like a jealous wife. You kind of have to be monogamous to get the best out of it. If you can understand the analogy, you have to be really committed to acquiring the skill, etc. And so it's very hard for you to have two main things especially during your period of training. And I just needed you all to be able to understand that even as you're making a decision to get into a surgical specialty. Thank you.
Thank you so much, Doc. I think you've tackled all the questions that are there. If everyone has any question, I think this video will be available to rewatch. Doc, asante sana. I think we'll bid you farewell and we'll go to Ortho from Moi. If Dr. Owiti is in the call, Doc, I think you can present so that we have Ortho both sides you present, and then we move to general surgery.
Okay, thank you, Dr. Let me share my slides. Can you hear me?
Yes, Doc, you're audible. We're waiting for the slides and then, yeah.
Are my slides visible?
Yes, Doc, your slides are visible and you're audible.
Okay. Thank you, Dr. for this initiative. I remember when you called me about it, I was really happy that at least we are going to speak to people who are interested in joining residency, and that at least they're able to get a glimpse of what is going on in our various institutions before they make that decision to join the path. I'm Dr. Witi Silas. I'm the Chief Registrar in MED Orthopedic Surgery at Moi University. I know the things have been said, and even whatever Dr. Maura said. Actually, Dr. Maura was my classmate in undergraduate, so I rubber stamp everything that he has said with regards to orthopedics, the field of orthopedics. I don't know why my slides are not moving. Let me just... Okay. So I'll begin with an overview of orthopedic surgery program in Moi University. So basically, it's a full-time program. You will undertake this program at Moi University College of Health Sciences that is based in Eldoret town. Those who know Moi University, of course, the main campus is quite far. It's somewhere about 20 minutes from the town. But For College of Health Sciences programs, basically we are within the town. Our affiliate hospital is Moi Teaching and Referral Hospital. Usually the program commences in September of every year, and the cost is about 187,000 per year. Application process usually online. Just go to Moi University portal. You will be able to submit the documents, which is usually your undergraduate certificate, of course, letter of good conduct, ID, passport, yeah, among other things. And then once you submit, the documents are usually reviewed. Then once the faculty is satisfied with them, then from the portal, you'll be able to know whether you can proceed to the next step, which is usually now entry exams. So entry exams also usually online. So normally it's an MCQ exams. So normally the communication is passed via your email that you normally use during the application process. So you'll be able to know the day, the date, and then you'll be able to undertake the exams. So having been able to do, actually I did both exams for University of Nairobi and Moi. So I had a test of both. And I felt like the Moi one was a bit tough. And it focused actually more on orthopedics. The one we did for UON was general, most everything in surgery. So general surgery, basically. I don't know whether that has changed now, but the exam we took when I was applying, the Moi one focused more on orthopedics. So once you pass, you'll be able to know your results the same day, and you'll be able to know whether you're proceeding to the next step. So you have to pass the MCQ. And then once you pass, you move to the oral exam, which is normally taken by the faculty. So oral exam, usually you might be asked a few things with regards to orthopedics, but of course, they also always want to know how you're going to support yourself during your studies, okay? Whether you're sponsored, whether basically so that they are sure that you are able to take care of yourself and you don't have distractions with regards to your studies, which of course the major one is usually financial issues. So once they're satisfied with that, then of course they always pass communication via email that you have been selected, and then an offer letter will follow a few days later. So the duration is 4 years. It's divided into part 1 and part 2. Part 1 is 1 year for the first academic year, and part 2 takes 3 years. So in part 1, usually the first week, the program begins from the first week. So usually you don't have a lot of time to waste, okay? So from the first week, it's usually orientation. Then the second week, there's a course that everyone joining postgraduate is introduced to. It's called Innovative Medical Education. So having done my undergraduate in UON, I found that Moi program was a bit different. And I think that's the reason they introduced you to their program with this course called Innovative Medical Education, where basically you are introduced to the way of learning. They call it student-directed learning. So most of the things you're supposed to do by yourself. And then, of course, the lecturers and the tutors are there just to solve or you're able to consult, but you're the one directing the way you want your learning to go. So I think that's why before you start the program, they introduce you to this course so that everyone is brought at par. So after that, then there are common units, biostatistics, research methods, epidemiology, and health service management. So usually, basically, these topics are vital because they're going to help you in your research and in your thesis. So of course, you will apply biostatistics, you'll apply research methods, a bit of epidemiology, and of course, since at postgraduate you're expected to be a manager, you are basically the role of this HSM is just to equip you with a few skills that you're going to apply once you finish your course as a manager in your department. Then once you're done, these three courses have cuts and exams. So cuts are both takeaways and written. Then once you're done with the courses, you do exams and you finish with them. Before now you move to the next areas. So it's important to take them seriously during your time, because the department has allowed you to focus and do the exams and pass them so that they don't become a bother later during your clinical areas. So usually these courses take about 4 months, your first 4 months. Then the next is biomedical sciences, which include physiology, pathology, and anatomy. So physiology, usually you don't do the entire physiology. You do basically what is relevant to surgery. And usually you do it, everyone doing surgical disciplines, so general surgery, orthopedics, and anesthesia. Usually you share those classes. And then you also do pathology. Pathology, of course, has various categories. So you will review your hematology, you will review your immunology, you will review your anatomic pathology, you will review biochemistry, and even a bit of bacteriology. Okay. So once you're done with that, then of course there's also the anatomy. Anatomy, there's the dissection part and the lectures, which basically you are the ones preparing the presentations. Then the lecturer usually just moderates the session, and then you organize dissection sessions. So again, in part one, you're expected to develop your proposal during the same first year. And also in your first year, you are rotating in accident and emergency. So basically, you will be the first on call. So first on call, basically, you're the first person to review all orthopedic cases in accident and emergency, and sometimes the reviews in the wards. But since you will be doing these other courses, so usually you don't do calls during the day. So from Monday to Friday, you're expected to do this call from 5 p.m. to midnight. Then after that, the second on call takes over. So I think the idea is that we expect that you will be in class or you will be doing some other activities during the day. So during the day, you don't take call. But in the evening up to midnight, you will be in A&E reviewing the orthopedic cases and consulting with your seniors, making decisions. So the idea is the idea of this is that you get exposed to orthopedics early, because remember, the course takes 4 years. So you don't have a lot of liberty or a lot of time. So that's why from your first year, you're exposed to orthopedics. Then, of course, during the first year, there are cuts. So there are cuts in physiology, there are cuts in pathology, anatomy can be taken away, can be written. And then later you will do exams. So how do you pass part one? So there are three conditions. You must have paid the fees for the first academic year, which I had said is 187,200. Then you are expected to have submitted your proposal to the IREC and get approval. I know sometimes it's not easy developing proposal and getting IREC approval, but sometimes they just want at least just submission, even if you don't have approval, and then you will be allowed to sit exam. But the rule of the Senate is that before they discuss your exams, then you must have gotten an IREC approval. And I know there's been leniency from our department, so sometimes we just proceed and then you get the approval later when you're starting part two. But it is important to know that that is the rule. Then of course you must also pass those three units that I said: anatomy, physiology, and pathology. But usually they emphasize a lot on anatomy, passing anatomy. The other ones, if you have maybe a retake or you have a supplementary, you can always take it later. Then part two has 3 academic years. So this is where you begin your clinical rotations. So the rotations are divided into general and orthopedics. So general rotation, basically you're exposed to other fields of surgery because you need these skills and knowledge even in your daily practice. So you will rotate in cardiothoracic surgery, general surgery, plastics, ICU, neurosurgery, and radiology. I usually take about 12 weeks, so about 2 weeks in each rotation. And when you're in those rotations, you are expected to take calls, participate in ward works, ward rounds, and the like. And also even during their electives, even though they don't really emphasize this, because sometimes joining a general surgery elective might not really help a focused orthopedic surgeon. But it's usually up to you to decide if you want to participate in their electives. But calls and wards, you have to participate. Then you will begin your now orthopedic rotations. So here you now join orthopedic department. And here, the department is organized into farms and special rotations. During this time, you're also moving to be the second on call for 1 year, and then thereafter you'll be the third on call. So if you're in second on call, basically you are reviewing patients during the day, because when the first on call is not available. And then you're also supposed to participate in theater. So for emergency cases, you review, and then you go to theater with your third on call to operate on those cases. Again, this is the time you will be, so in your various farms, there are elective days, there are ward rounds days, there are clinic days. So you will be exposed to all that during when you're in orthopedic rotation. So usually the department, we have what we call trauma meetings every day from 7:15 a.m. where we just discuss the cases that were done by the previous team on call. So if you experience an open fracture or a dislocation or any cases that you reviewed, every case that you reviewed, you come and present. So the team on call comes and presents whatever they interacted with the previous day. So that happens every morning. Then we also have monthly journal clubs. During this time, you're also expected to develop your thesis. And then you also have lectures and tutorials. So just like expected, usually you're given a topic, you prepare on it, and then you present with the moderation of the consultants. So the thematic areas, of course, we have trauma, peds, ortho, spine surgery, arthroplasty, sports, foot and ankle, hand, and general orthopedics. So this is how the farms are organized. We have 3 farms. So farm 1, you will be exposed to trauma, arthroplasty, sports, foot and ankle, and oncology. Then farm 2, again, trauma, spine surgery, and hand. Then in farm 3, you'll be exposed to peds, ortho. Then the specialties that, again, you will be rotating in include sports, spine, and arthroplasty. Then at some point, you will be expected to go for external rotation. Usually, everyone goes to Kiwa and St. Luke's Orthopedics Hospital. So in Kiwa, you will be exposed majorly to orthopedics, to pediatric orthopedics. And then in St. Luke's, you'll be exposed majorly to arthroplasty. So arthroplasty, shoulder, revision surgeries, yeah. So in as much as we also do arthroplasty in MTRH or in Moi referral, so you normally take about a month in St. Luke's just to get more experience with regards to arthroplasty. Then for sports and spine, we get exposure both in MTRH and the private hospitals around. So usually if you're rotating in those specialties, the consultants take you around whenever they're doing their private surgeries, you're supposed to be with them just to get exposure. So during this time, you're also expected to be filling your logbooks. So just logging in the cases, usually online. So when you're done with the case, you just key in the details and it is recorded somewhere. So when you're done, it will just go to the Department of Records, then they print it for you. Then, of course, like I said, each farm has a theater. So usually farm 1 has 2 theater days, farm 2 has also 2 theater days. There's a theater day for arthroplasty, there's a theater day for sport, there's a theater day for spine, and for peds ortho. And of course, major rounds and clinics. So what do you need to pass part 2? So of course, school fees has to come first. Remember, you paid the first academic year, but in your part 2, you are expected now to pay for the 3 years. So 187 times 3. So it's good to prepare and know at the back of your mind that when you are approaching completion, you're supposed to pay the 187,200 times 3. Then you must have defended your thesis for you to sit exam. Then the exams for part 2, normally you do 1 cut, 1 I, and thesis. So the 1 cut accounts for 40%. The end of year exam accounts for another 40%. Then the other 20 comes from your thesis. So of course, thesis, there's the marks for the book and for the defense. Exams basically for the cut and I, there's written exams. You have paper 1, 2, and 3. So these papers are organized into paper 1, majorly trauma. Then paper 2 is usually general orthopedics. So general orthopedics, the oncology part of orthopedics, infection, okay? All those other things that are not trauma. And then paper 3 is usually now the specialties. So the sports, the spine, the hand, the foot and ankle, all those go into paper 3. And of course, the arthroplasty. Then after that, there are normally also clinical exams. So where you here still do long cases, do one long case, and you do 4 short cases, sometimes 4 to 5. Of course, they're usually moderated or done by the faculty and an external examiner. So challenges, of course, like any other surgical postgraduate program, you will be dealing with sometimes long calls. I remember these calls are 24 hours. So sometimes you may have to operate the whole day and sometimes also at night. But there's at least some understanding. You're not expected to work the whole day and again the whole night. Because also remember, sometimes you're expected to have other activities during the following day. So the consultants here are a bit understanding. So if you work the whole day, at least the night, you can work maybe up to 2 a.m. or 1 a.m. Then you don't have to clear the list because again, high expectations. Of course, everyone has high expectations of you. You're expected to make the right decisions. If you are not sure, because you always consult with the consultant on call. So the team on call, usually you have first, second, third. Those are residents, and then a consultant on call every week. The program is self-driven. So again, if you relax a bit, then you will realize the 4 years are gone. Again, you're expected to develop your research, you're expected to be in the learning areas, you're expected to be in theater. So it's quite rigorous, maybe as compared to the program in UN. But remember, it's doable because people have been doing it. And I even have a friend in UN who did his program in 4 years. So I think the 4 years is just doable. Opportunities, there are fellowships. Of course, there is a lot of partnerships between the university and the universities abroad. So usually they give at least a chance to one person to every year to go and see what happens in Indiana University. But again, MTRH also has partnerships with some universities abroad. Remember, even our current spine surgeon did his fellowship in Canada as a result of that partnership between MTRH and McMaster University. Locally, there are plans to start hand fellowship, hand and upper limb fellowship. So those are things that those are some of the opportunities that you may have when you join. Of course, once you interact with the team and you show interest, it will be, of course, easier to join such programs. So, why would you choose ortho? I think it has a lot of satisfaction in terms of both the doctor and even the patient. And usually you see immediate results, like someone comes not able to walk. You take them to theater the following day, they're up on their feet. Then after a few months, they throw away the crutch to see what you did. You know, orthopedics is the only field where whatever you do can be seen by anyone around the world. So someone just need to take an X-ray to see what kind of fixation you did. So if you do a good work, of course, you see the satisfaction immediately. It has diverse subspecialties, because like even Dr. Maura said, we have sports, spine, proplasty. So you can subspecialize to any of those fields. Then, of course, the future of robotics is here with us. I think Kijabe or Kiwa actually working on starting robotic surgeries very soon. So when I was rotating there, I think that was their plan. So if you're interested in innovation and technology, then this is a field for you. We meet and we interact with trauma every day. Degenerative conditions are there every day. So the demand for your services will always be there. And of course, that's why we are operating almost every day. Not almost, every day of the week, there is an orthopedic theater that is going on. And orthopedic wards are always full. So that just shows there's demand. It's a challenging and active environment. So of course, most people think orthopedics are just carpenters, but this field requires you to integrate your anatomy, your physiology, your pathology, and a bit of biomechanics. Okay, of course you have to be physically fit, because sometimes reducing those bones is not very easy. So why would you choose Moi or MTRH? Most people don't know that actually the MED program, Moi was the first to begin this MED program in 2006. And then was, I think, even though UN graduated the first lot, but Moi was the first to begin MED. Then I think when they were in their second year, then Moi transitioned general surgery residents to Otto, and then they graduated a bit earlier than Moi. Because the history of this is that I think for some time, there was a bit of reluctancy by some of our seniors to start the MED program. The idea was you have to go and do general surgery first, and then after that, you come and specialize in orthopedics. Because I think that was the reason, because I think most of them underwent that route. The old guards went through general surgery and then orthopedics. So they thought that should be the way. So for a time there was dragging. And then now I think they're just brave people who decided, no, let's start this program, let's start this residency. It's a shorter duration, as I had said, 4 years. You get good exposure, mainly because I think Moi takes few people. The usual number I've seen is 7, 8, 9. Rarely more than 10. I think even in my class we were just 5. But of course, we also have the COSEXA residency that adds to that number. So COSEXA usually 2 plus the Moi. So usually about 10 in total. So that will ensure that you're exposed to a good number of cases and you live when you're comfortable. The faculty is quite supportive, and there's actually a seamless cooperation between the university and MTRH consultants, to an extent that, of course, Moi is known for strikes and stuff like that, but orthopedic department is usually not affected when there's the university strike, because majority of the supervisors are from MTRH side. So even if they strike, usually we just continue, because most of our supervisors are from the hospital side. like I said, the SDL, student directed learning, once you go through it, for sure, you will be a master. Then of course fees is less, 187, 200 per year. I'm sure amenities around here are also affordable as compared to maybe other towns. If you're an ortho bro, of course ortho bros are known to like going to the gym. So there are quite many and they're affordable. And they're also good ones. Again, if you're like me, who you're a person who doesn't like the hustling and bustling and a lot of traffic, then this is the city. You're welcome to this city. That's the end of my presentation. Thank you.
Thank you, Doc, so much for the exhaustive presentation. And we'll go to the questions right now. If anyone has a question about the Moi Orthopedics program, kindly ask in the chat, or you can unmute and ask as well. Guys, any questions, ask in the chat. Look, I think your presentation and Dr. Maura's presentation have been exhaustive in terms of orthopedics. Looks like most guys don't have any question for author. We'd like to say thank you for the great presentation. And of course, thank you for taking the time to take us through this presentation for the program in Moi. We appreciate, and I think our young colleagues have benefited. And if someone comes to Moi after watching this, it means that you've influenced their decision to come to Moi. Asante sana daktari.
Thank you, Daktari. And I appreciate giving me this opportunity to talk to colleagues who would like to join this field and also would like to join residency. I think it's something that you could continue doing because it's I think it's an important thing to be exposed to what you expect even before you make that decision to join whichever program. So once again, thank you. And I'll request you allow me to drop off.
Thank you so much, Doc. And asante sana. Have a good day.
Okay,
Right now, we'll move to general surgery. We'll be inviting Dr. Mboya, who is the Deputy Chief Reg for general surgery at the University of Nairobi. Then we'll go to Dr. Maureen, and finally, we'll finish with urology. So those are the three presentations that are pending. Dr. Mboya, if you're in the call, kindly join.
Good afternoon. Thank you for this opportunity. Just a minute as I try to share my screen. So, are you able to see my screen?
Yes, kindly put it in slideshow.
All right. I'm audible enough?
Yeah, you're audible, but if you could increase the volume, it will be better.
So thank you, Dr. Adan and placement for this opportunity. It's a great initiative to be able to speak to our colleagues and be able to give them a heads up on what to expect when coming in for MED. So as Dr. Adan has said, my name is Dr. Mboya. I'm the Deputy Chief Resident in General Surgery, University of Nairobi. And I'll just give you some insights into how the General Surgery program is and what to expect. So as my colleagues, Dr. Kiriga, Dr. Moura have already said, we are all in the same department, which is the Department of Surgery, but with various subunits, and mine will be the General Surgery. So in terms of application, the procedure is the same as my colleagues have said. The application is usually open up to May, so you can send in your applications at any time through the University of Nairobi portal. And the requirements are still the same as my colleagues have said. So that means you need to have a certified documents of your KCSE exams or equivalent, depending on where you're coming from. Certified documents of your MPCHB degree or equivalent. You must be registered with the Kenya Medical Practitioners Board, and you must have an indemnity cover. So apart from that, the department will also need to see certified copies of your academic transcripts, and you must have completed your mandatory 1-year internship after completing your undergraduate studies. So our intake is usually once in a year, usually in August or September. So as I've said, the application is open up to May, but the other thing that you should know, you should always visit the website so that you're up to date on any changes that are made or any announcements that are made from the department. So this is just the link I put here for the website that you'll use to register your account, then have your account validated, which is through your email, and then log in to start your process. So there will be prompts at every stage, so you'll be able to see what you need to upload. And in case you don't have them, you can always save where you are and then come back later and upload the documents that you didn't have certified or something like that. In case you have inquiries about your applications or any issues, there is also a support line. You can send an email to the online app at students.un.ac.ke so that you're able to be assisted through your registration process or application process as soon as possible. So in terms of examination, it's the same as the other departments. You'll always have an exam, which will be online offsite, MCQs. Could be 100, could be 150, just depends on what the department has decided. But remember that there's a time period. So they will tell you have 100 MCQs to be done in 60 minutes. So make sure you do the questions in good time, because sometimes the timer goes off as soon as the 60-minute ends. So just ensure you know how many questions are there, assign time per question. Of course, some questions may be more difficult than others, so you may just plan yourself so that you're able to do enough questions before the timer goes off. And once you pass your MCQ, then you'll have an oral examination, which will also be online offsite. And it will be done by a panel of consultants. You may have a panel of 5 or 6 consultants. Probably like 3 of them will ask you medical questions or surgical questions related to general surgery. And then the others will ask you about your finances, how you plan to support yourself, and other social questions that relate to you as a person. So always check your account to be able to see your results and then to be able to download your admission letter, because that is something that you'll need when you come for registration. So in terms of the admission, after you've passed your exams and you've been admitted to whatever faculty, for us will be general surgery, you'll have your application letter, which will be sent to you via email and will be available online in your portal. The academic year starts in August, September, so you should plan yourself, all your activities before school starts. Our campus is called the University of Nairobi, KNH campus, which is within the Kenyatta National Hospital campus. School fees in terms of general surgery, like other surgical disciplines, ranges between 300 to 350. Remember that some people will be self-sponsored. So if you have job opportunities or you're working, you may have to streamline your duties with your facility. For those who are government-sponsored, you have to get a letter of release from your counties, and that needs to be certified by the Ministry of Health, and then you bring it to the department, finance department, so that they're able to know that you'll be sponsored by the government and facilitate your fees and any other issues to be streamlined. You will have to have a portal, UN student portal, once you have your registration number, so that you can log in there, you can see your school fees payments, you can see your marks, you can register your courses, you can apply for your school ID and all those things within that portal. At admission, you'll also have to go through the ICT so that you have your biometrics done. And then after that, you'll have an induction meeting. So this induction meeting is usually done in the Department of Surgery, and it will be inclusive of all registrars. So whether you applied for cardiothoracic surgery, for orthopedics, for GenSurg, for neuro, the induction meeting will be one, so that you're introduced to your faculty, you're introduced to your chief registrars, and any other leaders that you need to know of. So in terms of the Department of Surgery, we are technically the mother of all departments, as it has been since time immemorial. So we tend to decide more things as much as other units have their leaders. So the people you need to know when you come to University of Nairobi, Department of Surgery, is one, the Dean of the School of Medicine, who is Prof. Daniel Otuka, the Chairman of the Department of Surgery, the Dr. Naim, the Program Director, Dr. Magofa, because those are the people you will be interacting with most often. Then you also need to know your head of unit, who is Dr. Kiptun, our chief resident in absentia today, Dr. Kenti, myself as the deputy, and then the secretary of the department, the administrator, the IT specialist, so that if you have any issues, you can either go directly through your deputy or your chief or through the department. In terms of our program for GS, the first year is actually what we call the principles of surgery, or the basic year, because what you'll be doing is like 2 weeks of research methodology, which is examinable. You'll have an MCQ exam and an ACQ exam at the end of the 2 weeks of research methodology. Please remember that you need to pass your research methodology as well, as it is important. Then you'll have modular structure of the basic sciences, which is your anatomy, your physiology, and then you'll have your pathology, which includes all these subunits, the hematology, microbe, pathology, anatomic pathology, that is, microbiology, bacteriology. All this will be done either online or on-site, depending on the unit itself. After that, in between your modular activities, you'll have rotations in Kenyatta, which will be 5 to 6 week clinical rotations, and they'll include general surgery, orthopedics, ICU, and casualty as part of the principles of surgery 1. As always, you'll always have your assessment forms, and you'll have an end of year exam, which will be done at the close of your academic year. That is probably in July or August. For the second year, we call it Principles of Surgery 2. For this year, you'll be doing special rotations. So that means you'll be doing plastic, reconstructive, and aesthetic surgery for 3 months, neurosurgery for 3 months, pediatric surgery, and cardiothoracic surgery for 3 months. This is relevant because as a general surgeon, wherever you go, you may find yourself as the person who needs to give care primarily to any patient who comes to you. So you may be the first point of care for patients with burns. You may be the first point of care for patients with neurosurgical trauma, with an epidural or subdural hematoma. You may be the first point of care for that baby who comes with interception, or for a patient who comes with a stab onto the chest to the pneumo or hemothorax. So this is why you rotate through these units to be able to know how to provide basic surgical care for these patients. During each rotation, you'll have assessment forms that need to be signed by your supervisors. And then of the year, you'll also have your exams, which will be your MCQ, your structured answered questions, and then your OSCE. And your OSCE is always the most important examination for your year, as it carries the most marks, about 50 to 60%. So your third year is when we start the practice of surgery classes. So you have two rotations in general surgery. In Kenyatta, our wards are in the 5th floor, ward 5A, 5B, and 5D. So what I mean by two rotations in general surgery is that you may rotate in any of the three wards. You'll also have a 3-month urology rotation and a 3-month casualty rotation. So the importance of this is to introduce you to the practice of surgery, whereby you now start being a first on call. You review patients in casualty, you review patients in clinics, in the wards, make a decision, of course, with your seniors, your second or third on call, and your consultants involved. And then you also take part in surgical cases, whether emergency or elective. So when you're in your third year, most times you find yourself working as an assistant surgeon so that you get used to the procedures, get to learn the steps, and then later on your seniors will let you do the cases of the primary surgeon. At any time, if you're stuck, you can call your seniors, you can call your consultants, as this is mostly peer learning or apprenticeship. Casualty rotation gives you that first-hand experience with trauma patients, decision-making, rescue management, damage control, and all that. Urology also introduces you to the aspects of surgical management of patients with the urological emergencies and conditions. During the initiation of this new curriculum, there's a qualification for you to move from third year to fourth year. You must have represented your thesis. You must have departmental approval, and you must have the Ethics and Research Board approval for you to progress to fourth year. And as always, there's always assessment forms in every rotation. So when it comes to fourth year, when you're in your third year, you're just being introduced to the procedures and how things are done. So you're more used to things in your unit, you become more confident, you're able to lead ward rounds, you're able to lead in procedures and all that. So you're growing more as a surgeon. So you'll have one surgical rotation in the wards, either 5A, B, or D. And then you've introduced an endoscopy rotation, which we do in Avenue Hospital, so that you're able to get exposure to endoscopy procedures, laparoscopy, ERCP, at least so that you know how these procedures are done, what are the complications, what are the findings, how do you describe what you find, and how do you manage these patients. You'll also have another urology rotation and a casualty rotation, all of them being 3 months. And at this point, you are expected to have completed your dissertation or thesis and submitted your assessment forms, as well as logbooks. I forgot to say, logbooks are present from first year all the way to 5th year. So at any point before your final exam for each year, you must have submitted your signed logbooks. So for 5th year, you're now more confident. You're able to do almost all procedures on your own as a primary surgeon, including laparoscopy and endoscopy. So you are technically the lead in any ward you go to, with your second and first on calls and your consultant above you. So you will be making the decisions mostly. Your consultant will be like the point where you just let them know, I have this patient come in with this condition. This is the decision I have made. This is the procedure I'd like to do. These are the complications I expect. And these are the pros of this procedure versus any other procedure that should have been done. So at this point, you're just discussing or letting your consultants know of the decisions you've made so that you see whether you're in agreement or these other plans that should be made. And once that is done, now you go into theater with your second first on call. You do the procedure as you teach them, or you supervise as they do it. You'll also have a casualty rotation. And as always, this rotations are each 3 months. At this point, you've already submitted your thesis for marking. You are also working on your logbooks and assessment forms, which should be submitted before the end of your last rotation. So the final exam, when it comes to 5th year, you have your MCQ, which is most often online, on-site, your SAQ, your OSCE exams, and your long case. Long case just means oral exam. So your OSCE and long case are the most important exams in your final year. And for everyone in general surgery, you must have done ATLS, because this is a basic requirement for every surgeon. So in terms of pros and cons of general surgery, as my colleagues have already said, you get a sense of community because you're working with your colleagues. You create rapport, you're able to stimulate yourself in terms of decision making and all that, and have a person who can actually cover you or, make you feel more confident in your decision so that as you grow as a surgeon, you're able to do the same for your juniors. You'll also have sufficient exposure, especially in Kenyatta. We have very many cases, and this is usually the first point of care when all other counties are on strike or if something happens, everyone comes to Kenyatta. So you realize you have enough workload and you have enough exposure for all cases. There's peer teaching. So you will grow fast as a surgeon, you grow as a teacher, you grow as a mentor, and you're able to do the same for your juniors as they come in. So that as you leave the school, there are people who say you've impacted them in terms of mentorship and teaching. There are many leadership opportunities, especially in general surgery. We have multiple tumor boards. We have hepatobiliary tumor board. We have breast tumor board on Tuesdays from 7 to 8 a.m. And all these are usually coordinated by a resident. We also have dissertation clinics and journals on Thursdays, and we have classes on Friday, which will be done by you. So you realize, apart from these, there is leadership in terms of being a chief or a deputy chief, which is usually on election basis. So there are many avenues, there are many opportunities for you to develop your leadership skills and explore what you want to do apart from just the surgical aspects. As my colleagues have already said as well, the cons is like the long working hours and calls. In general surgery, you realize that as you grow in terms of your years, as you get to fourth year to fifth year to become a second on call and third on call, you become more confident in your skills. You're like the most exposed person in the world. That means as much as your load becomes easier in terms of knowledge, skills, and everything, but your call hours become longer because now you'll be doing probably 1 week calls. You'll have a second on call and a first on call every time that you need to teach. So you'll find yourself being in the hospital almost always. Clinic, call, cases you may have a case, you're admitted on Monday for theater, but then you're called Monday night or Tuesday morning. You're the one to decide what cases are to be done electively and discuss with your consultants and be the lead surgeon. So that means every time of your day rotates around the hospital. In terms of mental and physical stress, we have to be honest. There's a lot of physical stress because you have to be up and about every other time. You have to be thinking about your ward. You have to be thinking about your clinic patients, organizing theater, making sure the guys in casualty are doing the right thing. So there's a lot of mental stress as well. But we try to encourage everyone to have hobbies. In case you feel like you're burnt out, we have leaves, which has been officially approved by the department. So you can always take your leave. The department says you can take 14 working days in any 3-month rotation. And that means in an academic year, you have about 36 working days. You can also take your paternity leave, you can take your maternity leave, you can take your sick leave. So whenever you feel burnt out or you need to rest, you're allowed to rest. So don't tire yourself, don't kill yourself in residency. I will also notice that you need to multitask. You have a lot of time that you spend in school, but remember for self-sponsored, you may need to work. Some people have families, some people have businesses. So you will have to learn how to take care of your time and ensure all the aspects of your life is covered. So in terms of opportunities and fellowship, in general surgery, you can specialize in upper GI or bariatric surgery. We don't have many fellowship opportunities in Kenya as of now. I think I know we recently started the colorectal fellowship, but it's not well developed. So that means most of the time you may have to get your fellowship opportunities from abroad. There's also laparoscopy, endoscopy, minimally invasive surgery, or robotic surgery. So we are currently doing multiple initiatives on laparoscopy and endoscopy in the country. Under the Surgical Society of Kenya, I think Kijabi also have a program for endoscopy. and the private hospitals. So you can get laparoscopy, endoscopy, though not a complete fellowship, but you can get short courses. Robotic surgery, we are yet to introduce that. We are hoping in the next few years we will be getting to robotic surgery. Endocrine surgery involves your thyroids, your adrenals, and all that. Breast and oncoplastic surgery. This is one field that we relate so much with the plastic surgeons, because even as breast surgeons, as we manage the breast cancers, we usually do modified radical mastectomy. Sometimes you may find after doing all that, you're not able to cover the area where you did your mastectomy. So most of us breast surgeons are able to do basic flaps and wound coverage. But then for the complex cases, we usually involve our plastic surgery colleagues so that we offer the patient best cosmetics or aesthetics after surgery. We also have colorectal surgery. Hepatobiliary surgery is coming up. We actually have a hepatobiliary clinic, liver transplant clinic, and we have multiple, I think we have about 3 hepatobiliary surgeons in Kenyatta right now. So you're able to get enough exposure to this, even as you think about what you want to subspecialize on. Surgical oncology, this is something you will be exposed to every day. Trauma and acute care surgery is also not very well developed in our country. I think it's kind of overlaps with the orthopedic surgery. Although in our aspect, we're talking about your patient who comes with blunt abdominal trauma, penetrating abdominal trauma. How are you going to manage them within the golden hour? So that's why we need trauma GS surgeons, so that you're able to do your splenectomy, liver salvaging procedures as soon as possible. So apart from the things which are curriculum, we have extra curriculum. But before that, as I've already mentioned, we have the tumor boards, dissociation clinics. You also have your monthly mortality and morbidity meetings, which will be the leaders in your wards. We have annual surgical camps and conference under the Surgical Society of Kenya. And for anyone who's interested, if you want exposure into what our society is like, in April from 22nd to 24th, we'll be having our surgical conference, SSK conference in Mombasa. You can join and see what colleagues in the GS world are presenting, the cases they've managed. You can interact with your colleagues, get more experience from senior and junior colleagues. And we usually have also annual camps, which SSK will post where exactly, because it's inter-county. I think last year we did in Homa Bay. This year I'm not sure where we'll do it, but it also gives you exposure or introduction to GS procedures. So in terms of memberships, as a general surgeon or general surgery resident, you'll need to be a member of the Surgical Society of Kenya, because it also gives you exposure to so many opportunities in terms of trainings, laparoscopy trainings, endoscopy trainings, the camps, the conferences. There's also under the Surgical Society of Kenya, we have the Kenya Association of Women Surgeons. So for the females who want to get into surgery, you can be a member of CAUS. There's so many activities that we do, including yoga, dinner parties, running, charity. I think right now we have an initiative of mentorship in schools for STEM mentorship. So you can also be a part of that. There's the Kenya Medical Association, the KMPDU. In UN, we have something called the Daktari Wellness Association, where my colleagues started this so that you are not just concentrating on school alone. You can actually ensure that you're fit. You have a community of colleagues you can interact with outside school, and you can have a healthy, all-round, holistic life. So in terms of accommodation, Dr. Maura had already alluded to this. You'll need to have your personal arrangements. Probably, if possible, find an accommodation around Kenyatta if you're coming to your end, and make sure that as soon as you get into the program, you make your application for the KNH housing, so that by the time you get into 3rd, 4th year, at least you've been allocated a house, and it makes it easier for you to be able to coordinate your schoolwork. So we always have CMEs, which are continuous medical educations that we do every other time in conjunction with our med reps and anyone who reaches out to us. It's also an opportunity to learn about new things or new drugs, new treatments, new procedures, new equipments, the management of our patients, and also just interact with your colleagues, have lunch, have dinner, and distress. So you can also take part in many games. We have an established football club in your end. So the guys who like football, you can join that, and you have competitions, you have games scheduled every other time, as well as tennis. If you are into running, there's a running club under the Daktari Wellness Association. And as a department, in conjunction with urology, we usually have our end of year party. So you can always join that, interact with your consultants, head of departments, nurses, everyone, and just have a good time and say thank you to your colleagues for the support they've given you throughout the whole year, and see what you're looking forward to in the next year. So in terms of my presentation, that is all. I think if anyone has a question, I can tackle it.
Thank you, Doc, for the wonderful presentation. I didn't think that you guys had a lot of fun in general surgery. And let's open the chat for any questions and comments. You can ask your questions in the stream. You can ask your questions here, or you can unmute and you can ask your question directly for Dr. Mboya. Thank you, Doc. I don't see any questions in the stream. Any question in the chat? Looks like we.
I think someone is asking about online webinars.
Oh, okay. Nice. Do you have online webinars where can? So this webinar here will be available on the YouTube channel, so you can watch anytime you can come back to it and check again for any clarification. We'll put the YouTube link there. Actually, right now it's streaming live. It's there in the chat. I'll talk about the upcoming webinars after we're done with today's presentation. We have webinars in the next 2 weeks to complete this series of mentorship. Doc, thanks so much for this presentation. Appreciate you taking the time, and I know you're on call today, so I know it was not easy, and we kept pushing your presentation. So thank you for bearing with us. Asante sana, Doc.
Thank you for the opportunity, and to everyone, I wish you all the best. If we see you in your end within the year, you can always reach out and we'll help you get through your MMed.
Excellent, Doc. Thank you so much. And now we'll be inviting Dr. Maureen Kosgei from the Moi University. She's the former chief reg of general surgery in Moi. Doctor, if you're in the call, you can start sharing. You can say hi and then start sharing your screen.
Hello. Good afternoon, everyone. Can you hear me well?
Hi, Doc. We can see your slide. Put it in slideshow, but your voice is breaking a bit.
Can you hear me well right now?
Yes. Excellent. Karibu, Daktari.
Okay, asante sana. Thank you for the opportunity to be part of this mentorship program. My name is Dr. Maureen. I'm a general surgery resident at Moi University, a med postgraduate year 4. I got to be a chief resident a bit earlier on because of some few issues here and there, but I'm the former chief reg currently. So I'm based at Moi University, where we train at MTRH. So I'll just be very, very brief in this presentation because I think we've had a lot from the other senior colleagues and our consultants. So this part will just be very, very brief. You can hear me okay?
Yes, Doc. Yeah, voice, you're audible very well.
Okay, so for general surgery at Moi University, it's a training program that's based at MTRH. It's a full-time course. Duration is 4 years, but sometimes it may take around 4.5 years to 5, depending on how resilient or how fast you are with your thesis. It requires at least 2 years post-internship experience. And when applying for the residency program, the portal at Moi opens at around April. The entrance exams are usually in between June to July. And these entrance exams, it comprises of a theory paper and an oral exam. So once you have applied, you'll get the exact requirements on our portal. Once you've applied, you'll be exposed to a theory paper. Usually there are around 180 questions, more focused on general surgery, but you'll have other questions on anesthesia, plastic surgery, but most of the paper, around more than 60%, is based on general surgery. Then immediately after that paper, you will wait for around maybe 2-3 hours where they go mark the papers, and then you'll get your results almost immediately. And those who have passed will proceed to the next stage of an oral exam. And this oral exam is conducted by, I think my oral exam, we had like 5 consultants in a panel where you're asked a few questions. Mostly, as others have said, it's always about if you can afford to take yourself through the residency program. So they'll ask you how you're going to take yourself through school, what are your financial sources, are you sponsored by the county or self-sponsored? And then they'll ask you just basic questions, but the rate limiting step is usually the theory paper. So if you're planning to come to general surgery or any surgical-based program at Moi, a lot of time should be taken to study the papers, and you can get some past papers from me, from any of the residents that you know. Those papers are usually very helpful in preparing for that exam. The pass mark is not fixed, usually based on performance of that year. So you'll find that if you have 20 residents, you really have to find yourself among the top 5 so that you're chosen for the oral exam, or rather top 10. So the more candidates there are, the lower your chances of getting in. And if there are fewer candidates for that year, you have quite a high chance of getting in. So it's really based on a year-to-year basis. For the program MED, we have part 1 and part 2. For part 1 is similar to my colleague's Dr. Whiting. So he talked about proposal development and direct approval. So in your first year, you have to come up with a topic. And when you have a topic, you need to get it through the IREC process to get approval. It's quite a rigorous step, and it's also a rate limiting step for you before you move on to your part 2. And then anatomy, physiology, biochemistry, immunology, pathology, epidemiology, biostatistics, and research methods. All these are topics that we go through in our first year. There's a lot of weight on anatomy and physiology. Those are the topics in which if you don't pass, you will not be able to proceed on to your second year, especially anatomy and physiology. So you have to pass the 2. The rest, they're not as hard and will not really stop you. What it will hinder you is that you have to do a supplementary exam for either one if you fail, so that you'll be able to go to the next year. Of course, there's some leniency depending on the year. There's some years that they don't allow you to progress, but some years you may be allowed to progress without your pass marks. But it's easier if you have passed everything, so that you don't get to your final year and then you're being told that you have not passed such. You did not pass your immunology, so you need to do a supplementary, and you're already in your 4th year. So it's just easier to pass, or rather handle your supplementary as early as possible. Also, what is different from the orthopedics program from the Gen Surg program is in our first year, we don't get to handle any calls. So it's basically just a theory year. And what I feel makes it better is that if you're a self-sponsored resident, you may be able to continue with your work during this first year. And you'll be able to save a bit more in preparation for your clinical years where you'll have less time to do your locums and whatnot. So it's a bit lenient on us such that in our first year, you can really juggle work and school if you're self-sponsored. So it really helps. For batch 2, takes 3 years or more if you want. In this, you get to rotate in pretty much almost all the departments, because as a general surgeon, you need to be very competent in most of these areas. So general surgery takes around 10 months. I feel like we should take more, but you can always spend more time in general surgery. Urology takes 2 months, plastic surgery 2 months, ENT 1 month, cardiothoracic 2 months, I repeated urology, but sorry. Critical care takes 1 month, pediatric surgery 3 months, neuro 3, endoscopy 2 months, and elective 2 months. And within this period of 3 years, you're expected to have done your data collection, analysis, and do your thesis presentation before you sit for your final year exam. So it's a rigorous program, and these 3 years are barely enough to cover everything. So you'll have to be on top of your toes from immediately you hit the clinical years so that you can gain both experience, you can be able to read and be a master, not really a master, but really have good competency skills in terms of all these areas. For requirements to complete, you have to have presented your thesis. At first you'll need to do departmental defense after you've done your data collection analysis and worked on your book. So you do a departmental defense, and after departmental defense, you now do a school defense before you finish. Then you also need the evidence to have completed your rotations. This is judged by your logbook. So as you're doing your rotations, you need to be filling up logbooks. The problem with this is the departments may not really require you to bring the logbook immediately after completion. So there's some bit of laxity over there. So you need to be on top of your toes, because as Dr. Vitti has said, it's usually self-directed learning. It's SDL. So there'll be no one on your case trying to tell you do this, do that, do that. So it's really self-based, and you have to push yourself. In terms of the fee structure, year 1 is usually a slightly higher. We pay around 187,000, and then the rest of the years is 185 each year. It's a lot cheaper as compared to the other programs, and this is why it's a bit better to come to Moi University, especially if you're self-sponsored. It's a bit cheaper, and you'll be able to, you can imagine with this, it's close to around 800,000 for the full year. So if you have a budget of, for example, 1 million, you'll be able to cover your school fees plus some extra on top. So it's a bit more affordable as compared to the other programs. In terms of living expenses, in Eldoret, it's not that pricey. So averagely between 50 to 70,000 per month, or even less depending on how, like if you have a family, if you don't have a family. So average expenses will not go beyond 70,000 depending on how you live. And also the low transport expenses, like if you find a house next to the hospital, it's even cheaper because you'll be able to just walk to work every other day. And at night, there's usually an ambulance that can get you wherever you are, especially if you're on call. So that moving around, you'll really save a lot on your transport expenses. So it's a lot cheaper to study here. Why Moi University? We have a very vast array of learning resources, library, skills lab, the number of patients that come to our facility, the number of consultants that are available for you to learn from and get skills from. There's always a professor or a consultant who has traveled from either Brown University or Indiana University or a partner university in Canada. So you always get somebody who will be able to mentor you and teach you in whatever aspect that you want to master in. So the learning resources are a lot. There's also one-on-one mentorship, given that we have peer residents. In general surgery, we usually admit between 5 and 8 candidates. I think 8 candidates is the most that has ever been seen admission per year. So usually it plays in my class, we have 5 candidates. The class ahead of me, we have 3 candidates. Behind me, 8 candidates. So never more than 8 per year. And with this few numbers, it allows for that one-on-one mentorship programs, which is very helpful, given that you can always be paired up with a consultant, or rather, depending on the interest, you can pair up with either an oncological surgeon and hepatobiliary surgeon, so that you can always learn from them. There's always opportunity to develop your surgical skills, and it builds a lot of confidence because of the problem-based learning. So most of the time, we'll find the residents operating in theater. The senior residents will always be operating, and the consultants may leave you to run an elective theater, which builds on your confidence, and you'll be able to finish with a lot of skill. In terms of challenges for my university, we have occasional strikes, but the good thing is, as we had said, it usually doesn't affect the residents, because our teachers are mostly based at MTRH. So if the university goes on strike, you'll find that the residents are still continuing their rotations and they're counted. Another challenge is balancing life and school, but this is on a personal basis. And what I feel is, if you have a certain goal in life and you work at it, you'll always be able to clear out your priorities and find what is necessary for you at that moment in time. In terms of finances, in Eldoret, specifically at MTRH, there's a program that you can discuss with the MO in charge at MTRH, and they'll always allow you to have certain locums that are very friendly to residents. So whenever you have any challenges in terms of finances, you will be put on a rota for a locum within the hospital, which really assists the residents to be able to manage their finances, especially for the self-sponsored residents who are having a very tough time. But in terms of finances, before you start your residency, have a clear and well-outlined plan of how you're going to manage. Because personally, I'm a self-sponsored resident, and before you start, you need to have like your finances sorted out, because it will reach a time that you're always on call, always at the hospital, many cases, clinic, ward work to do, and you'll not have that time for local. And also chasing your thesis, your data collection. It will just be easier if you already had a financial plan when you're starting, so that you don't have to really worry about paying your rent at the end of the month while you're worried about your surgical workload and all this. So it's very important, and that's the one thing that I'd always tell the MOs before you actually decide to come to masters. Have your finances in order. It can be very challenging, and it may lead to overthrowing the balance of handling school and handling your finances. So you may tend to go towards the depression. You may tend to quit school midway, which is not advisable, because you'll be losing momentum. You may tend to do other things that will not be of gain to you. So having your finances in a row is better off before you actually come for residency. The other challenge is the long working hours, which cut across all the surgical fields. The working hours, it's just like that part that you cannot even take it away. It's part of it. You need to understand that you're going to be living at the hospital most of your days. So that is why I'm telling you finances are important, because if you're worried about rent and food money while you have very long working hours, you can really go into depression and I've seen some cases of suicide thoughts. So please have them in a row before you come for residency. So why pick general surgery as a residency? Or if you're asking, should I pick it? But I'd say yes, of course, because of the impact in our society. My counterpart from your end has said that most of the time when you reach the hospital, and specifically in our low to middle income countries, the first person you encounter is a general surgeon. And we are the ones who make the greatest impact. You will be able to do those life-saving procedures before you actually get to a neurosurgeon, before you actually get to a urologist or a cardiothoracic surgeon. Will have already made some impact on it. So it has a lot of the impact in our society is quite felt. Even in most hospitals, you'll find that the counties, you never find a facility without a general surgeon. So we are usually the first ones to be employed by a facility. The first contact on the ground, also because of our numbers. But currently I'm seeing a trend where we have fewer general surgeons as opposed to the other specialties. The orthopedic surgeons are really coming up. Even in MTRH, we have more orthopedic surgeons than general surgeons. So our numbers are now going declining. So we should have more people picking general surgery as a specialty. We also get to do a lot of life-saving procedures with minimal equipment. And unfortunately, most theaters in our country are poorly equipped. So you get that general surgeons, as long as you have a fully working anesthetic machines and you have good sutures, you'll be able to do a lot of procedures, because we don't, for the basic operations, we really don't require a lot of equipments like, drills and implants and whatnot that the other counterparts may have. So we get to do a lot of procedures, and that is what is needed in those small county theaters, and we get to do a lot of life-saving procedures. The subspecialization opportunities my colleague has talked about them, and it's a vast array. Like, there's so much that you can go to subspecialize in, and all of them are very interesting, but you need to love what you do. So I'll talk about one thing that no one has talked really about, is that what will keep you going when you have those long working hours, when your finances are not well aligned. So passion is what keeps us going. If you don't have passion for surgery, please just leave it alone, because when it's tough, and it can get really tough, passion is what will get you going. So have that love. Go through your internship, go through surgery, go through IMED, go through pediatrics. Try and figure out what when you go home, what do you keep thinking about? That's the passion that is required, so that you can be going on through the tough areas. And also having a clear and well-defined goal. It doesn't matter whether it's finances, whether it's the prestige, whether it's whatever that you have in mind. If it's a clear and a well-defined goal, that is what will get you going. So have both, have either. That is really much required in our practice. And as I said, if you do what you love, you'll never work a day in your life. So if you love surgery and you actually love being in theater and operating, you'll never see it as a working day, in as much as most of the time it is. But if you love it, you'll never have all these other problems. So thank you for listening. And if you have any questions, kindly let me know.
Thank you, Doc, for the awesome presentation and for the words of advice to our young colleagues, and for also taking the time and joining us today. Anyone who has any question, kindly put it in the chat. In the YouTube stream, you can put it in the stream. Or you can unmute yourself and ask the question directly. Okay. Let me see if there's any question in the stream. Right. I don't see any question in the stream. I don't see any question in the chat. All right, so it looks like it was an exhaustive general surgery presentation for both you and Dr. Mboya. Doc, thank you so much for taking the time and joining us. I appreciate this, your time.
Thank you, and allow me to step out. So I hope that all of you or some of you may pick general surgery out of this. Thank you and have a good day.
You too, Doc. Thanks so much. And now for our final presentation for the day, I'd like to welcome Dr. Alex. Dr. Alex is a Deputy Registrar in Urology. Urology is at UON, University of Nairobi. I'd like to invite Doc to present his slides.
Thank you, Dr. Eden. Can you see my slides?
Yes, kindly put them in slideshow.
Okay, you can still see my slides, eh?
Yes, they're good now.
Okay, thank you. So my name is Alex Owino. I'm a postgraduate here for Masters of Medicine in Urology at the University of Nairobi. So I'll be speaking briefly about urology residency at the University of Nairobi. I would wish to not take a lot of time because there's a lot of overlap with what the previous speakers had presented. So getting into it. So as a medical officer or a medical officer intern, you probably pondered on what specialty you would wish to pursue after maybe your internship and a few years of practicing as a medical officer. So personally, my choice for urology was not really guided by any persuasions that I had. But I had an opportunity to work with a urologist in Kitui County, where I practiced as a medical officer. And the advice he gave me at that time was that the urology is a good surgical specialty because out of all the other surgical specialties, it's the one which most of the time you get to sleep well. So far, I think I agree with him that actually urology you can get to sleep well, but not really in residency, but during in your practice, which if you get into the journey, you will get to see why. So urology as a specialty has a wide variety of practice. We have endourology, we have uro-oncology, we have transplant urology, reconstructive urology. So it's wider than what is commonly thought, that urology is just surgery that involves the urinary system and the male reproductive system. There's a wide range of things that you could get to do in urology. Then with the practice of urology, also there's a high impact on patients' quality of life. It's one of the surgical specialties where you get to see dramatic changes in a patient's condition once an intervention is made. For example, a patient coming with a blood outlet obstruction, probably due to a BPH, and you do a TURP, it's so satisfying seeing the outcomes. A patient telling you they haven't been able to void per urethra, and suddenly after a 2-3 hour procedure, they get to recover the ability to void normally. So there's a high patient and doctor satisfaction in terms of the outcome we get from urological cases. Then it's also a technological advanced field. I would say in at Kenyatta National Hospital, where our training is based, a lot of urology is endourology, usually minimally invasive, and open procedures are still there, but are not as many as the endourological procedures. These include the TURPs, laser lithotripsies for patients with kidney or ureteric stones. We also have transurethral resections of bladder tumors, ureteric stent placements, among many others, which you'd get to see once you get into the field. There's also lots of conferences, both locally and international, that most of the urological residents get to participate in, make presentations, as well as network with peers, both locally and regionally. It gives you a good experience and a world view of how the practice looks like. So for entry requirements, they're pretty much similar to what my colleague Dr. Mboya had talked about. So the application is through the UN portal, which is usually open between March and April. There's an application fee, which I think is about 3,000 shillings. You also need to have a Bachelor of Medicine and Bachelor of Surgery degree or an equivalent from a recognized institution. You have to have completed the mandatory internship training period. There's usually they usually say you're supposed to have a 2-year post-internship experience, though I don't think it really matters as much. You also need to have a valid practicing license, recommendation letter, and a CV. Then there's the entry exams, which include MCQs and an oral interview. These usually happen around May. The MCQs, you usually do the same MCQ with the general surgery group, pediatric surgery, and I think orthopedics. We sit the same exam. It's an online MCQ, about 50 questions. So revising for this entry exams is usually important. You could always reach out to any of your colleague residents who have done similar exams for past papers and any other relevant advice. Then there's an oral interview, which happens around May. You'll be asked about 2 to 3 clinical questions. Then you'll be asked about how you'd be able to finance your studies, because surgical training, it's a full-time program and tends to be rigorous, just like the other specialties. So you might be required to provide clarity on how you fund your training while in the you're training while in the program, so that you don't have interruptions during the period of your training. The intake is usually in September, where you start with the the first year, which includes the basic sciences. It's nowadays it's been intertwined with a few clinical rotations, plus there's a unit in research methodology. So the total of duration of training is 5 years. The rotations include your rotation in urology, which starts in third year. Then in urology, there's the special rotations, which include in endourology, uro-oncology, interventional radiology, and the transplant surgery. So in your first year, you have your basic sciences, which include anatomy, physiology, pathology. Then you also have another unit in principles of surgery 1 and research methods. Other than that, you have the 6 weeks rotations in general surgery, orthopedics, accident and emergencies, and ICU. Then in second year, you have rotations, special rotations in plastics and reconstructive surgery, pediatric surgery, thoracic and cardiovascular surgery, and the neurosurgery. All of these, which 3 months each, where you'd have to fill a logbook for each of these rotations and submit at the end of the year, after which you will sit an exam. Perhaps I forgot to mention, in first year, you also sit an exam for all the basic sciences, research methodology, and principles of surgery 1, in order to be able to progress to second year. So in third year is where you go into the urology department now. Usually it has, you have 3 rotations within the department and 1 external rotation. Each of these are 3 months. And for you to progress to fourth year, you have to have prepared your dissertation proposal, presented it, and submit to ethics and research committee. Then in the fourth year, you have 2 rotations in urology. Each of these are 3 months. You rotation in hello, can you hear me?
Yes, Doc, all is good.
Okay, thank you. So in your fourth year, you'll have 2 rotations in urology, 1 rotation in the renal unit, where basically it's a transplant rotation, and you have 1 external rotation to facilities that have to facilities that have a fully functional urological unit. So For us, our external rotation, we usually do them in the national referral hospitals, that is at MTRH and Kenyatta University Teaching and Referral Hospital. We also have a collaboration with Kizabe Mission Hospital. Then the rotation in transplant, you will basically just be handling the transplant patients. So in KNH, usually do one transplant a week. So during your time in that rotation, your work is mainly to prepare the transplant patients pre-operatively. You also need to assist during the day of the transplant for either the donor or the recipient. And post-operative surgical care, you also be the one to handle that and discuss with the consultants involved the patient's progress and overall management for the patients after transplant. In your 5th year, you have 3 rotations in urology and 1 rotation in one external rotation. After which you sit a final exam, which includes MCQs, SAQs, and OSCEs. So to proceed from 4th year to 5th year, you also need to have completed your dissertation and submitted your dissertation to the Department of Surgery. So what constitutes a day in your life? Basically, it's similar to what the other speakers have talked about. You have ward coverage, clinics, elective theaters, and call duties. So in urology, we usually have 3 firms. Each of them have their different elective theater days, and then there's 2 theater days that are usually shared amongst the firms, and 1 day is dedicated for transplant. That is Wednesday. Yeah. So some of the challenges you might encounter, just like the other surgical specialties, is of course the calls involve long working hours. There's a high workload as expected in surgery, and just overall work-life balance might be a bit challenging. You might not get to have the social life that you had as a medical officer or an MO intern, but it's always important to create time for yourself, and the little free time that you get, make sure you just use it on things that won't harm your progression during the training. So some of the opportunities in urology, it provides a background for subspecialty fellowship. You can go the endourology path, transplant surgery, reconstructive urology, uro-oncology, and urodynamics. There's also a lot of research opportunities in urology. Most of the consultants in urology will encourage you to do a lot of research, especially in urological malignancies, where we lack a lot of local data to better inform our patient treatment. There's also, once you become a urological resident, you become a member of the Kenya Association of Urological Surgeons, and there's a lot of house events and conferences that you will be encouraged to participate in. And it's also good to note that in urology, there's a lot of partnerships with the pharmaceutical companies, which provide a lot of support for attending some of these conferences, both locally and internationally. Personally, since I joined the department, they've sponsored me through three local conferences and one international. And once you get into the department, it's easy to find out how to collaborate with these pharmaceutical partners. Aside from that, you also be able to network through these conferences with already established urological surgeons across the country, who will expose you to wider scope of the practice that you might not be able to see in KNH. For example, right now we have newer technologies in the management of benign prostatic enlargement. We have what we call RISM, which is basically water vaporization of the prostate glands, reducing its size. It's technology coming up, and it's done in a few facilities within the country. We've had one case done at KNH. So these are some of the things you get from networking with these other urologists during the CAUS conferences. So finally, I'd like to thank Dr. Edan for the opportunity to share my experience as a urological resident at the University of Nairobi. And I would encourage a lot of you to apply and join us in the Kenya Association of Urological Surgeons. Thank you.
Thank you so much, Doc. I really appreciate your time today. Not many people know about urology, so I think this is a great chance for the team to really learn about urology, and it's actually an upcoming specialty that requires more doctors to join. So let me see if there are any questions in the stream and in this chat, and then we can go from there. Let me see. So I don't see any. So guys, that brings us to the end of our presentation. Dr. Thank you so much for this presentation. And I'd like to thank all the presenters today who've taken the time out of their busy schedule and to come and present to us. Dr. We appreciate your time, and we appreciate the knowledge that you've given to the rest of our junior colleagues who are planning to join postgraduate. So, guys, I'd like to give a small presentation about next week. So next week we'll be doing specials. Specials are, like I mentioned earlier, dermatology, anesthesiology, psychiatry, and ophthalmology, ENT. And we had an issue with the presenter for pediatric surgery. He had an emergency. So we'll also put pediatric surgery next week. After that, then we're planning maybe to do the collegiate based system to see how the other side as well. So and we also do the CTVS next week as well. So we'll also do cardiothoracic surgery next week as well. And all right. So like I was saying earlier, and for next week, we are planning for pediatric surgery, cardiothoracic surgery, dermatology, anesthesiology. We're also planning for psychiatry as well and radiology. So if you are interested in any other special rotation, kindly share so that ENT and ophthalmology as well. Kindly share here so that we plan for it as well next week. Are there any other special program disciplines that you're interested in that are not included in the ones that I mentioned? All right. So as we're thinking of the next, let me share my screen and show you the programs that we have for postgraduate. So this is our website. So this is our channel. So you type pacemedicine.com here, and then you go down. So after you go down, then you go to entry exams. After you go to entry exams, so you can choose surgery, internal medicine, pediatrics, obstetrics, and gynecology. So we have surgeries combined. So if you're doing urology, if you're doing pediatric surgery, all of it they're combined here. So you can come and practice here. So today let's take a snapshot of internal medicine and check how it is. So this is the exam for internal medicine. Let's do one and we see. So these are the internal medicine MCQs. So let me preview the quiz. So we have 400 questions, and we are putting more questions in the portal of the previous entry exams that were done in internal medicine. So let me do an example of this question. A 25-year-old man is diagnosed with chronic hepatitis B. So let me just use any answer, and then we check. So see, I got the right answer by accident. So it shows you how it will come out and how it will show in terms of. So it's a way to revise, and it's a way for people who've been medical officers who've forgotten pathophysiology or all that. This is an easy way for them to remember and study, so that you don't have to study multiple materials. So for those who want to join and take part in this entry exams, we will share our So that's it for our presentation for guys who want to join our entry exams. If you're interested, we're going to share the channel so that you guys are up to date with if you want to revise for entry exams and so on and so forth. So in a few, we're going to share the website, the links, and then you can call it a day. So there it is. You can see it. Click on that, join, and then we'll share the details of the entry exams there, and you guys can revise there. So see you next week, same time, same place, with the special program for those who are interested in the specials. And then we'll also do the CTVS and pediatric surgery that we did not do today. All right. Have a good day, and see you next week.